All right, time to talk to the doc. Here is Friday, the 30th of July. I'm J.R. Lewis. Good to have you listening with us on KLAM and KCDV, or perhaps at youtube.com/Cordova TV. Want to do kind of a weekend recap with Dr. Sanders about how things have been going on this daily briefing. These come to you as they are developed in the 1, 5, and 8 p.m. hours on the radio, and then posted to youtube.com/Cordova TV as soon as possible. So let's see what Dr. Sanders has to say about our progress. Doctor, good to have you on with us again. And why don't we start by kind of getting the lay of the land in terms of, are we still trending up, trending down, trending level, trending better, trending worse, just overall?
Yeah, thank you. So as our dashboard reflects, Cordova has 48 active cases. Yesterday, we identified 9 new cases. Since the start of this outbreak, shortly after the start of the outbreak, we have been experiencing community spread here in Cordova. We do have confirmation that this outbreak is the Delta variant. For the last week, our percent positive for testing locally has been 21.9%. So it continues to be a very high value. We continue to see this variant is spreading rapidly. People that are vaccinated continue to get sick with this variant. However, they are not getting as sick as individuals that are unvaccinated. So far in Cordova, we have not had any vaccinated individuals experience significant complications from this. So we are seeing that the vaccine is very helpful, and we're continuing to encourage people to come and get vaccinated.
Okay. And so the hospitalization and death numbers continue to be almost entirely among vaccinated people in Alaska, and we haven't had fatalities, I guess, that I know of, but is that the same for Cordova?
Yes, I think across the country we are still seeing that the complications from COVID are occurring in people that are unvaccinated. So hospitalizations as well as people that are dying from the illness are occurring in unvaccinated individuals at an incredibly high rate, approximately 96%.
Okay. And I have actually had some questions directed at me to pass on to you regarding vaccination. Have we seen an increase in people coming in to get shots since this outbreak started, or has that not really changed very much?
We have seen a small increase. In the beginning when we first had vaccine, we were giving hundreds of doses in a day. Now, over the last month, we've given just over 60, and over the last week, we've given 6. So we are seeing a small uptick in vaccine interest, but we would be glad if that number was higher.
All right. So say in the last 30 days, it's maybe averaged one vaccination a day, right in there?
No. Over 30 days would be kind of closer to 2 if you were to average. We're just over 60 individuals for the last month.
In the last month. All right. What about how to get vaccinated and when to get tested? What are the hours and procedures for that these days?
Great. So the vaccine, you can still sign up online. You can still call the 424-3045, or you can call either clinic, the hospital, outpatient clinic, or a Lonka clinic. They are giving vaccinations weekly, and we are able to get people scheduled relatively quickly after they sign up for the vaccine. We continue to have multiple vaccination options available, and people are almost given the ability to choose exactly which one they want. Occasionally, we'll be giving doses of Pfizer and encourage somebody to choose between Moderna and Pfizer. But for the most part, people can have the freedom of choice here, which is very fortunate.
Yeah.
The testing, we have been doing testing, opening up pods on an as-needed basis. Because this is continuing to be a prolonged outbreak, we're going to start doing testing regularly at the hospital ambulance bay drive-through 9 a.m. on Tuesdays for 1 hour. So 9 to 10 a.m. on Tuesdays, individuals can come in and be tested. We have received some requests from people to offer alternate hours for testing. We are not going to do that at this point. One of the identified reasons was that we needed to accommodate work schedules. We do ask, if you are getting tested, you are somebody that we would ask to be at home, quarantining, and not working. The reasons for testing are that you are either having symptoms or a close contact and are high risk for spreading illness, and we would ask that you be very cautious. So,
okay, so in other words, that if you are concerned, I mean, if you're coming in to get tested, if you're concerned that you need to be tested, you're probably in a situation where you shouldn't be out in the general public anyway, at work or much of anywhere, but isolating at home, like you said.
Exactly. There are some special cases where we do some asymptomatic screening that is specific to workforces or employers. The employer will allow time for that testing, and that is set up outside of this open community testing. So.
Okay. All right. So in terms of, I guess, sort of how we're doing, I mean, we were as high as 70 cases at one point, and then, some of them in the initial batch began to recover. What is your sort of broad view from the box seats, I guess?
Yeah, so I think that one of the things that we're seeing here on the ground, the medical community is seeing, is with this variant, people are getting sicker. They are getting sick more quickly, and this is spreading throughout households at a very, very high rate. So early on, we would see an individual in a home get sick, and we didn't always see all the household contacts end up coming down with COVID. Now we're seeing almost 100% of household contacts will come down with COVID. So that has our attention. We're really wanting people to be cautious. I know everybody's seen the CDC recommendations, which we had recommended similarly over the last couple of weeks, universal masking. The masking does help decrease the spread, and it decreases that viral load that's being shared. It helps decrease the severity of this illness's impact on our community. So we're asking everybody, please mask up, please wear masks when you're in an indoor public space. And
right.
Yeah.
So when you talk about people being sicker if they get the Delta variant, thinking again about the vaccinated folks who are at much lower risk for hospitalization and even lower risk than that for becoming a fatality. In the cases of the breakthrough infections, how sick do people seem to be, say compared to influenza?
That's hard. Everybody's immune system handles things different. I've heard some people describe that it feels kind of similar to the second dose of their vaccine. Some people didn't get sick from the second dose of the vaccine. It seems like it feels like a very bad cold or flu for, on average, maybe 3 or 4 days for vaccinated individuals. And for other people, we are seeing them feeling ill for sometimes even weeks, but certainly 7 to 10 days is a very common period of time for them to be feeling very under the weather.
Okay, so it does linger even in the vaccinated people. If you catch it, it's definitely, or I shouldn't say it's typically not awesome.
Yeah, it is. People definitely feel like they are getting very sick even when they're vaccinated. That's enough that it is wiping them out for a period of time.
Okay. One other thing that was on my list that I have seen that, again, is another one of these that's been asked of me directly to ask you, and I've seen chatter about it a little bit in some of the forums, is the changes to the dashboard. I mean, we used to have what seemed to be a fairly data-rich set of blocks there, and now it's just down to 2. So why the change there?
So the medical response team, which is compiled of a large number of providers from both clinics, looked at the data and looked at the cumulative case count and recognized that that number wasn't really an accurate reflection of what's going on in Cordova. It doesn't give us a sense of Cordova's natural immunity because it included a large number of individuals that are no longer here in Cordova, were visitors passing through, were here as seasonal workers. So that cumulative case count number was taken off the dashboard as it was felt that, one, it wasn't an accurate reflection of the number of cases that had been here and wasn't really helping us to protect the community or understand what's going on. A similar thing with our cumulative vaccination rate. We have immunized a number of people that are not here in Cordova any longer or that don't reside here. So we don't have a very accurate number for our percent of vaccination. I think most of us here that are participating believe that number is somewhere around 60%, but again, it's we don't have accurate data on that number, so we stopped putting that as part of the dashboard. We have requested the state give us a little bit more community-focused information to see if they can extract what our vaccination rate is here in Cordova. Right now, we are lumped in with the Cordova-Valdez census area, which is very large, and as we know, doesn't necessarily entirely reflect Cordova's data either. The other thing that we stopped reporting on was the resident versus non-resident. This distinction, as we looked at how we were collecting that information, we found that it was not an accurate distinction of who's resident and who isn't resident. So we stopped reporting on that number, that data point as well. The way that we were recording that was based on an individual's address, and sometimes people were using temporary addresses. And so again, that distinction was just difficult. The final data point that has changed off the dashboard is the local hospitalization. We have received feedback that some people felt that this was disclosing their private health information. We are a very, very small community. And so certainly during the COVID pandemic, we want to ensure that we are helping keep the community safe, but we also are required to operate under the HIPAA standards, which require that minimum necessary information is put out to the public in terms of private health information in order to achieve our goal. The advertising the hospitalization rate here locally does not help us to achieve our goal of protecting the community, and we were receiving some concern that it was too much of individuals' private health information being put out there, so we took that number away as well.
Yeah, well, because obviously, as you pointed out, we're very different from, say, Anchorage or someplace where that is a much more anonymous type of number. It's very easy if somebody's in the hospital with this for word of who it is to spread around. So, yeah, I can see that.
Exactly. We also see, there are other communities, maybe some are significantly larger than ours, some are a little larger. They have had different interpretations. Each community has different sensitivity around this information. The local medical community is working really hard to ensure that we are keeping people informed and safe, and this is what we feel is meeting that minimum necessary standard, but also keeping people informed. We really want people to know and understand we do have community spread.
Right.
We have the Delta variant. It is spreading very quickly, and people need to behave and take risks accordingly.
Sure. I mean, basically, it seems like a lot of the things that we used to do pretty much, right, as far as masks and trying to stay apart and that kind of thing.
Yes.
All right. And then if I heard you right, just to summarize again on the dashboard, so putting those cumulative numbers up was actually tending to basically inflate our sense of how many people have had it, how many people might be immune, how many people have vaccinated. It was actually over-reporting, in a sense, for Cordova to have those numbers up because of all the transient folks?
Exactly.
Okay. All right. Well, that makes sense, and we'll see if folks have any more questions. As I've always said, if anybody has questions that they'd like to have asked of you during this, let me know what they are, and then we combine that with the questions that you get, Doctor, and hopefully get everybody the knowledge that they want. Anything else as we kind of wrap it up?
I think the final thing is people ask, when should I be tested? So anybody that has this symptoms consistent with COVID, we want you to get tested. If you are unvaccinated and you are contacted or a known contact of a positive case, we would like you to come get tested within 5 to 7 days of that exposure. We also ask that you quarantine during that time for 10 days after the exposure and monitor symptoms very closely for 14 days. Fully vaccinated people, the CDC just released a new guidance that we also want fully vaccinated people to get tested 5 days after exposure as well, and to wear a mask in public settings and be extra cautious with behaviors for those 14 days. So if you're vaccinated and a close contact or unvaccinated and a close contact, we ask that you come through our weekly testing, which is Tuesdays at 9 a.m., and get tested at that testing time. The medical community is working really hard to continue to provide healthcare for Cordova while also integrating this testing and vaccination into our schedules. So if people can try to utilize that community testing time, that will be the most effective use of our resources.
Yeah, that's a part that's easy to forget, of course, is that COVID is not the only thing that our clinics and hospitals are dealing with. There's all the usual stuff as well. So that's a real good point. And as far as what's the best source, do you think, these days of up-to-date information if somebody wants to click and be able to see these things that you said, different rules for vaccinated, different rules for unvaccinated, or different requests of those two groups for Cordova in terms of how Cordova is responding? What's the best source of information?
Cordova is following CDC guidance very closely, so I certainly recommend people to go to the CDC website. It is very clear, it has excellent information, and can use that as the tool. That is the tool that all the healthcare providers are using here as well.
Okay. Well, I thank you for the time. Good conversation. Hope you have a good weekend, and again, hope we can get this thing turned around.
Yeah, thank you.
All right, once again, always good information from Dr. Sanders. We are glad to have her on this daily briefing for the 30th of July in the 1, 5, and 8 p.m. hours on the radio as needed. And then we get them up to youtube.com/Cordova TV as soon as possible. Glad you could tune in. Again, reviewing these online if you want to hear them again sort of slower or at your own pace. If you want to share this information with anybody that you think ought to be able to hear it, that YouTube channel is a real good way to go about it, so feel free to pass that along. And like we said, do these as we need them, so we'll see you for the next one when it comes around. Thanks for listening to KLAM and KCDV.